Okay, so I actually don't have anyone to record now. It fell through, whatever. So I'm doing it on my own. I'm just propping it up. So I've just got like my phone facing me. So here's my room. Okay, everything. I've got all my stuff over here. I've got this guy here, which I will move it and make sure it's like positioned correctly. So I'm just gonna hang this up on my thing. Make sure that this is at a good level. Okay, and then I've got all my supplies ready to go right here. And so I'll just film this way and hopefully this will work and you can see everything. Okay, so to start, I'm gonna check my chart, make sure I know who my patient is and what I need to do. And so today I know that I will be drawing a blood sample, I'll be starting an IV, taking an IV, disconnecting an IV, and then I will be doing a dressing change on the central line and then drawing a sample from the central line, okay? So I'll knock. Hello, my name's Dee. I'm gonna be your nurse today. I go wash my hands and get my gloves on. All right, so today I just need to get a sample, urine or just a blood lab from you. Okay, so I've got my gloves on. Can you go ahead and give me your name and date of birth? Confirm their identity. Okay, so I'm gonna get them sitting upright, positioned, make sure the bed is like at a good level for me as well. Get their arm in a good position and look over it real quick, make sure that this is gonna be a good place for me to even take my sample from. Okay, so I've looked over. Okay, and so then what I'm gonna do is kind of explain the procedure. We just need to get a lab, just in this vial here. It'll be just a quick, easy procedure, and I'll walk them through as I go. So, to get started, now that I know this is going to be a good arm, I'm going to place this underneath them so that I don't get anything on them in case something like that happens. And then get my stuff set up right here. Okay. So I've looked, I know that it's going to be a good spot. I'm going to feel, make sure I find the vein that I want to do. So I've located a vein. My blood bag is ready. Okay, now I'm going to clean the area off really well and then make sure that it's completely dry before I go ahead and do that. So, cleaned off my area. While that's drying, I'm going to get my stuff ready. So I'm using the butterfly. Now that it's dry, I'm going to unclamp with an okay. You're going to feel a little pinch. So I'm not going to touch the area, but I can pull back the skin a little if I need to. Okay, so I know where I'm going. I'm going to go in at like a 15 degree angle because I want to make sure that I'm going down enough into the skin. Okay, and I believe it's 15 to 30. So I'm going to go down into the vein. Straighten out a little. Okay, I have my flash of blood right here, so I know that I'm in. I'm going just a little more. Okay, and so I've got this down, so I see that I've got my blood here. Okay, now I'm going to take this part. I'm just going to take the cap off my, this is going to be, I'm going to put it on here. Okay, now that I've got that, I'm going to put this on. You can see my vial is filling up. So I'm being very careful not to like mess with the needle and have it go anywhere. And this vial will just be what they need for their sample. It is no longer pulling in the blood, so I know that I'm done. So I'm going to take the sample off, and if it's the kind of sample that you need to mix up, I would do that. Okay. cotton swab. Put it over and then just pull out. Okay. Leave that there. And then this safety locks it. I would put this in my sharps container, which is all the way over the room. So this went in the sharps container, which I will do in 2 seconds. And then if I need to put a Band-Aid over. Okay. I would put this in a biohazard bag and make sure it gets delivered to the labs. I'm gonna make sure to throw this away so I don't have to like leave the camera. So I'll throw it away after everything. Okay, and this as well. Okay, so next, I'm gonna take this off. Okay, get this out from under them, sit them up, get them positioned in a comfortable position, and check if there's anything they need, get them their call light, and that would be it. For my next thing, I would check, see what I need to do. I'm going to be inserting an IV, and so I've got my patient and the orders that I've got to get the IV started. So I would knock on the door. Hello, my name is Dee. I'm going to be your nurse today. Can I get your name and name and date of birth? Get their 2 identifiers. I would come in the room, let them know that I'm going to do an IV on their arm today. Get them started. Sit my patient up properly and comfortably. Make sure I check the arm, just make sure everything looks good. Okay, so we're gonna insert an IV today. I'm just gonna do it here on your arm. Everything looks good, so I'm gonna get you set up. And the reason for this is, if we need to push medications, do saline, anything like that. So let them know the purpose of our IV today. So they're set up, they're good to go. I've looked at their arm. This is gonna be like a good arm to use, so I'm gonna get them set up. So I've done my hand hygiene and I've got my gloves on. Okay. So to get them set up, now that they're in a good position, their bed is in a place that's gonna be good for me as well. I've got their arm in the correct position. Out like this. Okay. Before I do anything, I'm going to set up my saline lock. So I don't want to put the tourniquet on and have them just sitting with a tourniquet. So I'll open that up on my saline. Got primed. Okay. Now I've got this. I'm going to take my saline off. On. And then my cap is going to come off so that it's ready to go. I'm going to do this over here. Okay, so this is primed and ready to go. I'm going to leave it in here so that it doesn't get contaminated, and just leave it here ready to go for when I need it. Okay. All right, now I'm going to find the vein that I want to use. Make sure that's pumped up. Okay. So I've located the vein that I want to use. I'm going to get the rest of my stuff set up. Okay. I'm going to get their arm in the tourniquet. I'm going to do it, make sure to do it above the site. I'm going to get it nice and tight, and in the tie where I can just pull it straight out. Okay, so I've got it like that, so I can pull this and it just will automatically come down. Okay, so good. Okay, I've got my vein now, good to go. Take my alcohol swab or whatever I've got to clean my area really good. Sometimes the alcohol swab can also help the vein come up a little. Okay, got that nice and clean. Toss that. I'm gonna wait for it to dry, so while I get my other stuff set up. So I'm gonna be using this, and I've got my IV needle ready. Okay, and so I'll just let them know so it's gonna be just a little poke, and then we'll get it all set so that it doesn't come out. And so so I've got my thing is dry now. Okay, it's off. I've got my bevel is gonna be up, so shovel up. Okay, again, I'm not gonna touch the area. And could undo this right at the last or wait till after. So I've got my vein. I'm gonna pull back the skin if I need to. Insert. So I feel that little pop. Okay, my blood's come through, so I've got my flash. So now I'm gonna just level out a little and go in. Okay, I don't know if you can see my blood right there. Oh yeah, you can see it. Okay, so there's my blood. Oh, please don't fall, camera. Okay, so I've got that, and then I also have this ready to go. So I'm gonna slowly pull this and make sure that I can see the blood following it, which I can. And so I'm gonna slowly do that, okay? And I'm gonna pull this and get it ready. Because once I pull this out, blood might go everywhere. Okay, so got that. Okay. Got my saline lock. Okay. And I'm being extra careful to make sure that I don't pull the catheter out that I already have. Okay. And so now I want to pull back a little, make sure I've still got blood, which I do. And then as I'm pushing a little saline in, I'm going to slowly make sure I slide my catheter. And the saline's flowing well, so I know that I'm still in the vein. Okay. Now I want to make sure that my catheter is going to stay in place. So I'm going to lock this and then get my securing device. So I'm making sure this isn't going anywhere. I've got my little crease right here. I'm going to lay it over so that I can still change this. So I don't want to make it so that I can't have access to that. So I'm going to just place it right over. Peel this off. Okay. And then, because we're going to have a little bit of extra cord here, I want to tape this kind of out of the way if it's not going to get hooked up to anything quite yet. So I'm just going to kind of tape this so it doesn't flop around. Okay, now that that's set up, clean up a little because I spilled. Okay, they're good to go. Okay, now I'm going to label my IV that I've done. So I'm gonna put my initial, so DB, the date, it's 11-9/21, and the time, 11:24 a.m. Okay. My gloves are being difficult, so, oh, nope, I want to keep my gloves on. Just kidding. There we go. Okay, I'm just gonna lay this right here on it. Okay, I got my name, the date, and the time. Okay, so it's all set up, good to go. Okay, this will also be going in a sharps container. Set that there for now. My gloves off. Make sure that they're comfortable. Lay them how they would like to be again. Take the tourniquet off. Get this out from under them. And set them up how they'd like to be. Okay, so now if I'm going to take the IV out, I've got my doctor's orders to remove the IV from the patient that I know that I'm going to confirm. So, and I've got all my supplies with me. Knock on the door. Hello, my name is Dee. I'm going to be your nurse today, and I'm going to be taking your IV out. Can I get your name and date of birth? Confirm my patient. Okay, great. So we don't need this access IV anymore, so we're just going to be removing it. And so I'm going to go wash my hands, get my gloves on. To do this, okay, so I've got my cotton swab here that I'll need, and then just in case it's like sticking, I've got something to like help remove it. Okay, so I'm gonna get this tape off first. Okay, so very carefully, without accidentally yanking out the catheter at the same time, I'm just gonna kind of work my way around and pull this off, like making sure I'm stabilizing the IV. Okay, so I'm still stabilizing, working my way all the way around. Okay. And then I'm going to be pulling up. Okay, my catheter is still stable. I'm going to take my cotton swab, hold it right over, and then slowly pull out. And then dispose of this. No sharps, so it doesn't need to be in the sharps. Okay, and then I would make sure that I put a Band-Aid over or something like that. Okay, and so now I have my IV out. Okay. My last thing, I'm gonna get this guy right there. So I'm gonna move the arm over here. This guy. Okay. And then I'll move my camera so that we can see it well. And so I took my gloves off and sat them back up and gave them their call light. So now, how do I want to do this? I'm gonna move this to here. Okay. Okay, you can see that, right? Okay, good. So my next patient, I need to change their dressing. And so I would confirm my patient, figure out my order, make sure that that's it, that is what I'm doing. So I would knock on the door. Hello, my name's Dee, I'm gonna be your nurse. We're just gonna change your dressing real quickly. And so confirm who they are. So name, date of birth, confirm who my patient is. Okay, great. So I'm just gonna clean, I'm just gonna get this dressing changed today and I'll walk you through it, but first I'm gonna wash my hands, do my hand hygiene, and then kind of explain the procedure. So I'll get them in a comfortable position for both them and myself and let them know that we don't want to be breathing on it once, especially once it's off, so they have the option to wear a mask or turn their head as I'm doing this, and so they've chosen to just turn their head. So I'm gonna get my mask on first. Okay, and then I'll get my gloves on. Okay, so I'll let them know that first I'm just gonna take this off. I do have, I've got my kit here, so I've got my kit, I've got my sterile gloves. And so I'll let them know that, kind of step by step what I'm doing. First, I've got this just in case it's sticking really bad, an adhesive remover. And so I'll start by peeling off the bandage. Okay, and again, I want to be very careful. Oh shoot, oh shoot. Okay, this is what I'm doing. I'm cleaning up blood. So that's what I'm doing right now. So I don't want to start my video over, so just give me a sec. Oh my gosh, what did I do? What the heck? What the heck? Oh no, this came unclamped. It's fine. resuming shortly. Come on. Whoa, get on the wall. Okay. Okay. I'm just gonna clean that up later. I am good enough. Okay, so that did not happen. Crap. Okay. Okay. So I was in the middle of taking off the bandage. Okay. Okay, so I'm taking off the Band-Aid, making sure that I'm being very careful of this, stabilizing, holding it down, using these if I need to, if it's sticking really bad, because I don't want to hurt them, I don't want to damage their skin. So I'm just working my way around. Okay, being extra careful. Okay, and now with this, I am pulling upward because I don't want to accidentally pull the catheter out. Okay, so going up. Okay, so my patient, again, has his head turned to the side. Now I'm going to get my sterile gloves on because this is now a sterile technique, or sterile field, whatever, I'm going to do it. So you can see everything. Okay. So first, I've got my sterile gloves, and then also I've got this. So first, I'm going to open this before I get my gloves on. Let's see. And I've got everything in here. You can't see that. Okay, I'm going to do it so you can see it. Okay, so I'm going to open this and have it ready so that I can do everything. In fact, I'm going to peel that off so I have more room. Okay, now I'm going to get my gloves on. Okay, making sure I'm not touching over there at all. Okay, pull my sleeves. Okay, so okay. Okay, throwing this away. Okay, hands are staying above. So now that I've got this, I can touch this stuff that's sterile in here. So I'm going to take this stuff out, and I'm going to get my sterile place setting for me so that I can lay out my supplies. Okay. So this table. Okay. Just gonna lay it here. So there. I don't want to touch anything now. Okay. And I'm going to set out everything I need. Dispose of that. Slide this over. Okay. Pause so I can move this up a little. Let's see. There we go. Okay. You can see. Okay. Unpause. I didn't touch anything with my sterile gloves. Okay. So I got my thing set out, and I was very carefully moved my stuff onto here, so now this is all sterile as well. Okay, now what I'm going to do is I'm going to open up my cleaning, to clean the wound, and then I've got my little tongs to hold it. So I'm going to take my first one, and I'm going to back and forth, and I want to get as close to the site as I can because I really want to make sure it's clean. And I lift this up and go under, okay, throw that away, take my second one, go off to the side, and forth, clean, throw it away, and third one, this side, so that way I've got all of it cleaned. I'm going to throw these away because now they're contaminated, okay, and now I'm going to take this little guy, I'm just going to put it right over here, making sure not to contaminate my gloves again. Good. And then pretend that I'm putting over the securement device or whatever that is. So the securement device would be on as well. So now that that is good and ready to go, I'm going to put this over. Okay. Again, I've got like this little crease here that is going to go right. Oh, you know what? I would have measured the catheter according to what was documented before. And so, because I want to be sure that it hasn't moved at all, and so I want to go into the chart and look and make sure that I know where they measured to, if they measured the whole thing, if they measured to this, this part right before the clamp. So I would have measured and documented that to make sure that it's still in the same place. And I would have done that before I had my sterile gloves on and all that. So it did get measured, and then I moved forward. So I know I need to be to the point where I'm not doing that, but in my defense, the blood kind of threw me a little. So, okay, so now that I've got this, I'm going to lay it right over top. Okay, that's good, like that. And then I'm going to initial, so DB, it's 11-9-21, and it's 11:24 a.m. But that would be written in Army time. Okay. This right over top of that. Okay, everything's good and secure. Make sure they're still doing okay. Let them know that they can turn and look and breathe again, that we're good to go. Remove my gloves, put them back in a comfortable position, and get them their call light and things like that. Okay, now for my final thing, let me get this stuff, let me get set up for a sec. Gloves. Okay. So I figure out, the labs, they need a sample from the central line. They can't do this, so they're coming with me. I know exactly what they need, so they're coming with me, knock on my door. Hello, my name's Dee, I'm your nurse. Can you identify yourself with your name and date of birth? Get that? Okay, great. We just need to get a sample for the labs, and so we're just going to draw up your sample right now. And I'm going to get them in a sitting position and make sure that they're comfortable. I've done my I'm going to go do my hand hygiene and get my gloves on for this. first thing I need to do, clean it off really good. And I'm going to draw up at least 5 mils. There is blood in there. You can't tell, but, and dispose of that. So this would go in like a biohazard. I would dispose of that. Okay. Then I'm going to wash this off again. Okay. Now I've got this is 4 labs. Put this on. And then I'm going to draw up however much they need. So let's say they need 5. So I'm going to draw up the 5. This blood is almost empty, but so if they needed 5, I'd have 5 drawn up. Okay. And then sharps container. I'm going to take off. Oh my gosh. Like that. Oh my gosh. Okay, well, in a normal situation, this would be clamped, and I'm going to take this piece off because I want to change it out. So normally I would, I'm just going to pretend that this came off with it. So take it off. I'm going to hand this just directly to my labs. They're going to take it and go. And then I'm going to put a new piece on here. I need a new one. And then finally, so now I've got my new piece on. I'm going to clean it off one more time. And I've got my saline to flush it. Pull it back a little. Okay. My saline. And then I'm going to flush it. Unclamp, then flush. Okay, perfect. Take that off and finish it by covering it with a new cap that has like the alcohol, the specific one that has like the cleansing cap on it. Cap and cover. Okay, and they are good to go. And then just like kind of to reiterate, the reason why I would pull back and disclose first is because if this was hooked up to something and I needed to unattach it first, there could be any sort of medicine in there. And so I would detach it, take away so that I have a clean sample the second time I pull. So, okay, sir, you're all finished. We've got the sample. I would sit him back up in a comfortable position, give him his call light, make sure he doesn't need anything, clean up all my stuff, and yeah, that's it. Hope I did it right. Thank goodness this blood doesn't stain. Mask off.